Hi, welcome back to my channel. I'm DentistJess and I'm so glad that you're here today. Today we are going to talk about toothbrushing. Definitely something that affects everybody. It's something that we are told to do from a young age, but I feel like a lot of us don't know how to do it properly. So my hopes in making this video is to inform you on how to pick the right kind of toothbrush and show you how to brush your teeth properly. So let's dive right in. So when it comes to picking a toothbrush, there's a few things that you want to look for. The first thing is that you really want to make sure that it has super soft bristles. The softer the better. Honestly, I don't even know why they make medium or hard toothbrushes anymore other than to clean the grout or tile in your bathroom, but it definitely should not be used on your teeth. It actually can cause a lot of damage to your gums and recession, and can wear away the tooth structure, so you definitely want to stick with the super soft bristles. So the softer the better. The other thing to do, to keep in mind when you're shopping for a toothbrush, is to look for one that has a smaller head. If you have a big one, it's actually a little bit harder to control, so you want to look for toothbrushes that have a little bit smaller head. So this is actually one of the ones that I use. It's got, as you can see, it's got the really fine, thin, soft bristles, and the head on it isn't too big. I also have an electric toothbrush that I will show you. So I'll show you how to brush with both of them so you can learn with either a manual or an electric depending on what you use at home. Now, most people when they're brushing their teeth, whenever I ask someone to show me, oh, how do you brush? You usually get the classic scrubbing back and forth, really kind of aggressively, scrub, side to side, that kind of a thing. And that's actually not how we want to brush our teeth. We want to be a little bit more gentle. You want to hold it with a super light grip. I usually say kind of like holding a pencil, or honestly, the closest thing I can think of is holding a flute. Which I don't play flute, so I don't know how I would know that. I feel like flute players are just very delicate, so maybe they're not, I don't know, but you hold it really nice and gently. So you want to hold the toothbrush, whether it's the electric or the manual one, in a nice, gentle, light, very easy, gentle, relaxed kind of motion. Okay, so to start, you put a little bit of toothpaste right onto your toothbrush. I usually just do a little almost pea-sized amount. I know on those toothbrush commercials it's always this big, huge flowing. You just need a little bit amount. And wet it. Again, really gentle pressure. And keeping that 45-degree angle. The electric toothbrush is that, unlike the manual where you're the one moving it, with the electric one it's moving for you. So basically what you want to do is once you turn it on, you want to tip it, same thing, at 45 degrees to your teeth, and then you don't need to do the gentle circular motion back and forth, it's doing it for you. So with a very light pressure, you're just going to angle it up a little bit and let it go as you go around. So we'll start it. One of the things that I've noticed a lot working with patients is that there's kind of three main spots that people miss a lot when they're brushing their teeth. The first one is a spot that probably most of you are aware of, because it's a spot that we always get things building up when you go in to get your teeth cleaned and scaled at the dentist. Usually it's where you have the most buildup, and it's right actually on the bottom, on the front of your on the back side, on the side where your tongue is, of your lower front teeth. That's a really good spot to get in there and make sure that you angle the toothbrush. I like to angle the toothbrush so that it's actually being held like this. So you've got one tooth per kind of the bristles as it goes around. Also, you want to make sure that if you're brushing with your right hand, you really want to make sure that on the right side, on the inside by your tongue, you're doing a really good job getting that clean. Same thing if you're left-handed, it's on the left-hand side, right on the bottom teeth and the inside by your tongue. For some reason, I don't know what it is, but the same side that we're dominant with, we have a hard time getting in there. And I noticed that there's a lot of buildup that happens right on the inside of those teeth. The third spot to keep in mind is actually the top molars on the cheek side. We want to make sure that we really get the bristles all the way up and around there, wrapping around the back of the tooth so that it gets nice and clean. Now, when you're using the toothbrush, it's really important to keep the bristles at an angle of about 45 degrees pointing towards the gums. So if you're on the top, you want to have the bristles angled about 45 degrees up towards the gum line, and if you're on the bottom, you want it about 45 degrees down towards the gum line. Now, a lot of people do that back and forth scrubbing motion. Again, we want to stay away from that because it's going to put a lot more pressure and it's going to actually do some damage to your gums. So what you want to do is you want to do a gentle, small, circular motion. It's kind of almost like a vibrating motion, but it's just gentle baby circles. And you want to slowly start working all the way around your teeth. We want to take about 2 minutes every time that we brush our teeth to get a full, thorough cleaning. And ideally, we need to brush our teeth in the morning, preferably after breakfast, and at night before we go to sleep. The one thing to keep in mind when we're brushing our teeth after we eat is it's actually good to wait for about 30 minutes or so. A lot of the times the foods that we eat, whether it's orange juice or coffee or whatever it is that you're having for lunch that day or breakfast or dinner or whatever it is, they can actually demineralize the tooth. What this means is that the acids that are in some of the foods that we eat can start to erode the tooth a little bit, and we actually need to wait for our saliva to buffer that a bit and give our enamel, which is the hard outer part of the tooth, some time to re-harden and remineralize. That's why we say it's good after you eat to have a glass of water, wait for a little bit, and then brush your teeth. It's also recommended to not always start brushing in the same spot. If you're always starting in the same spot, by the time that you get to the end, you're tired, you're over it, you're bored, whatever, you get lazy, I don't know, but it's good to kind of switch it up a little bit, and it keeps it more fun. Finally, make sure to don't forget to brush your tongue. A lot of the times people will brush their teeth and they totally forget that we have our tongue and our cheeks to kind of clean off afterwards, so make sure that you brush your tongue. When you're brushing your tongue, you want to start at the back and you actually want to, in one sweep, go down and out. You want to brush the bacteria, the food that's on your tongue actually out of your mouth. You don't want to just kind of scrub it around because that's not really getting rid of it. It's just scrubbing it into your tongue. So make sure that you brush your tongue, starting at the back, sweeping it all the way down and out. Finally, when it comes to storing your toothbrush, it's going to be really important to make sure that you're cleaning it off afterwards, because who wants to put a dirty toothbrush into your mouth? Rinse it really well, and then put it back into the cup or wherever you store it in your bathroom. Make sure that you're replacing your toothbrush every 3 to 4 months, or whenever the bristle heads start to get really frayed. Once they get frayed, it's usually a good sign that it needs to be replaced. We do that because 1, it's dirty, it's being used, it's gross. 2, it's less effective if the bristles aren't direct. We really want to make sure that those bristles are going up into that space between the gum and the tooth. That's why we want to have it at that 45-degree angle. And so we really want to make sure that we're getting in there in the most efficient way possible. The final thought I have on this is that when you are brushing the top of the teeth, make sure that you are getting right and top. So you're going to start on the outside, but make sure you're doing the top of the teeth as well, because we have these deep grooves on the tops of our teeth that we want to make sure that we're getting food or candy or whatever it is that you've had that day out of those grooves so that you don't start to have a cavity form there. So yeah, let me know what you think. If you have any other questions, I'd love to post somewhere below. Subscribe, ring the bell, hit that like button and share, and I look forward to hearing from you soon.